81-year-old male who has been in the hospital for 3 days and has been in and out of procedures since his admission. The patient came in with a mass on his liver and a suspected partial bowel obstruction as well as an acute kidney injury. The patient is also a prisoner and has been unable to ambulate since his arrival. Due to these factors, the patient developed a deep vein thrombosis, DVT, on day 3 of admission. The patient has a past medical history of hypertension, hyperlipidemia, and hypothyroidism. The patient is on the following medications outpatient: Lipitor 80 milligrams daily, Lisinopril 40 milligrams daily, Levothyroxine 50 micrograms daily, Carvedilol 25 milligrams twice a day. The new prescription written for this patient is the following: Eliquis 10 milligrams by mouth twice a day for 7 days, followed by 5 milligrams by mouth twice a day for DVT treatment. So whenever you see a question like this and you see the word Eliquis, you know they're going to test you about the dosage usually, because it depends on the indication and also depends on other factors. So when you go through the labs here, it says potassium 4.1. That's normal because it's between 3.5 and 5.5. Sodium normal between 135 and 145. BUN is about normal because it should be between like 8 and 18. So it's slightly elevated, but usually considered normal. Serum creatinine 1.8. This is definitely elevated, so you should always take note of that, because serum creatinine normally is between 0.6 and 1.2. So the question asks, as a pharmacist, which of the following is the correct action to take for this prescription? Choice A is verify the order as is. Choice B is change the dose to 5 milligrams by mouth twice a day, decreasing to 2.5 milligrams by mouth twice a day after 6 months. Choice C is change the dose to 2.5 milligrams by mouth twice a day. Choice D, change the dose to 15 milligrams twice a day for 21 days, followed by 20 milligrams once daily. Choice E, change the dose to 5 milligrams twice a day for 7 days, followed by 10 milligrams twice a day. So immediately when you see Eliquis, you should know the dose depending on the indication. So for this indication, they say this patient developed a DVT, so confirmed DVT. So the dose is this normally, 10 milligrams by mouth twice a day for 7 days, and then it's followed by 5 milligrams by mouth twice a day. The duration depends on if it's provoked versus unprovoked, but usually that's a very subjective statement, so they probably won't ask you about the duration. So far this is the correct dose of Eliquis. So now you have to confirm based on what the answer is in the choices. So since the indication is DVT, I already know the answer is verify the order as is if you memorize this dose. So the trick of this question is trying to see if you know what indication to look for, because the dose for a different indication, such as atrial fibrillation. So whenever you see this word as any diagnosis, you have to look at 3 different factors. The serum creatinine to see if it's greater than or equal to 1.5. Age, if it's at least 80. And also the body weight, if it's less than or equal to 60 kilograms. Because the dosage for AFib is different. It's just 5 milligrams by mouth twice a day. And whether this is the actual dose or it has to be renally dose adjusted, it depends on these factors right here. So if 2 of these 3 criteria are satisfied, then a dose from 5 milligrams twice a day, it changes to 2.5 milligrams twice a day. If they have 2 of the 3 of these criteria here. So let's pretend instead of this patient did not have DVT, if they had AFib, if they had confirmed AFib, then this patient would be on 2.5 milligrams twice a day, because this serum creatinine is greater than 1.5, because it's in this case 1.8, which is higher than 1.5. If it's at least 1.5, that's one criteria. And then age at least 80. This patient is 81. So if they're 80, 81, 82, 83, and so forth, anything higher, that's another criteria. So they satisfy two of these criteria. They don't satisfy the body weight, because the body weight is 89 kilograms. But it doesn't matter. If they satisfy at least two of the three criteria, then the dose for AFib is just 2.5 milligrams by mouth twice a day. So that's the trick to this question. Choice B, this is wrong, because the duration won't change for DVT. And then choice C, this is that criteria if they have AFib instead of DVT, then choice C would have been correct. So that's why it's not correct in this question, because they had DVT. And then choice D, change the dose to 15 milligrams by mouth twice a day for 21 days, followed by 20 milligrams twice a day, once daily. Eliquis dose is never higher than 10 milligrams. This question is trying to trick you, because this is actually the Xarelto dose. So that's why this choice is wrong, because Xarelto is only 2.5 milligrams or 5 milligrams or 10 milligrams. And the frequency is always twice a day, not once daily for Eliquis. And then choice E is wrong, because this is like they flopped the strength, because it should be 10 milligrams for 7 days and then 5 milligrams late after 7 days. So that's why choice E is wrong. So if you have any questions, please leave it in the comments.